I think you should, I think, be aware that this is the difference. But it was also different in Holland when we started. So it were not two different laws, but there were different systems where also the activities between home nursing, the nursing part, and the personal care part were split up. We said you should, where it's useful, you should integrate it, because when you deliver personal care, you get a good view on what people are able to do. So when you focus, for example, on the reablement, then you have to understand what is possible to reable. So then it becomes part of the nursing process that you are making people more self-supporting. So then the personal care is part of getting people more self-supporting. So that's the reason. So it's one of the reasons, and we see as a result that the amount of care needed, the amount of hours needed, is reducing. So it's reducing all the time throughout the years. Every year it's less. If you look at the system side, then as a company, as an organization, you can say, okay, when we have contracts with both systems, when we can deal with both systems, then as an organization, you can decide to integrate it. So Buurtzorg has to deal with 3 laws in Holland. So we have 3 laws and 3 different payment systems. But on a personal patient level, we try to integrate things as much as possible. So patients and nurses don't have to deal with the laws. So we see the laws as it's a given thing. So we have to. So I am making agreements with health insurance, with care offices, and with municipalities. And the care offices and the health insurance, that's about community healthcare. But we decide to integrate everything. So I just negotiate a certain tariff with these different entities. And based on this tariff, we can do everything within the organization we want to do. But most of the organizations says, okay, when we have this tariff and we are delivering these activities, we are going to split it up in different persons and different teams. We said, no, we are integrating it, and the money we get should be enough to pay for all the things we need in the organization. I don't know if I'm clear, but
yeah, it does make sense.
So I said you can deal with the system in different ways. So if the system is dealing with you and steering you, then it's not going to work. You have to find out how can you work with these 2 different laws, as you say, and how can you, when it's an advantage, yeah. So you should only do it when it's really an advantage, and it's also logic for nurses to combine these activities. So talking with nurses about, okay, what does it mean? What does community health nursing mean? Is it what the law said? Is it logic for nurses, or is it more logic for nurses that there is an integration of care, cure, and prevention? And till what extent is it logic? Because you can also decide to say, okay, the more stable chronic care, when it doesn't change a lot, can be done by nurse assistants. We have nurse assistants in the teams. So we have 3 education levels in the teams. So we said, but by the mix, we are able to do everything. And sometimes the nurse assistant takes care for terminal patients, which are coordinated by the bachelor nurse. But when, for example, when there is pain management and there is an infusion needed or whatever, then the bachelor nurse is taking care for that. So you have different qualities in a team, but the main purpose for the patient is the continuity in time and in person. So you can prevent the patient for getting too many people in their house by working with a small team which can do everything. So this, what you said about the system, you should think about it. You should build your business model on it. You should find out if it's enough or not. We had, for example, in Sweden, a very interesting discussion with the municipality where we are working in. And we said, okay, you can focus on the price per hour and you can focus on the costs per client per year. So there is a big difference. So what we see, many systems in Europe are focusing on the price per hour per activity. And I said, you should focus on the outcome on quality and outcome on quantity. So if you, by increasing the price per hour, if the outcome is that the cost per client per year goes down, then it's good for everybody. But it was quite in the beginning in Holland, was quite difficult to get this understanding, because the assumption is when you push the price per hour, it becomes cheaper.